All right, everybody. It is episode 10 and it is Tuesday, April 7th, and we have Monday data to add. So I wanted to start off in the US today, and we definitely had some underestimates yesterday, but it was a good underestimating day for the US because we only underestimated by 8,000. We were really off in Connecticut, although I've been watching a lot of the press briefings, and they're saying that because the testing is sporadic, that's causing jumps in the data. So some days when we get a big total like this, so for on Monday, we got a total of 6,906 people. It was a big jump, and because of testing lagging, meaning hospitals reporting to the state what the data is, sometimes it's a day behind. So the increase that we saw yesterday might have encompassed some of the Sunday total. Okay. So, anyways, let's get back to the US. So we want to put this one in for Monday. Like I said, we were off by 8,000 and change, and the actual was 367,004. So you are going to see the curve right now is right under 500,000 positive tests. If we put that in, we're a little bit over that now. We're at 517,000. So did jump up a little bit, but it certainly wasn't the kind of underestimate that we've been seeing the past few days. So that's some good news. Okay. The prediction for tomorrow, that's going to come in at 387,330. Okay. So if we have the same kind of residual as yesterday, we'll stay under 400,000, but today might be the day that we break 400,000 if it's off by a lot. So unfortunately, we are creeping up on that number. So we'll see how that goes. Let's save it and go into Connecticut. So, like I said, Connecticut was a big jump yesterday, but some of these cases might have been from the weekend. Some of the hospitals didn't report their numbers over the weekend. They reported them on Monday morning, I guess. So that might be something we see. But yeah, see how Monday is way higher than where the curve thought it would be, right? Monday is much higher than where the curve thought. So that's what's going to be dragging today's curve up. So we'll take the 69 and see. So now we're back at that 10,000 or 10,000 mark. So we were kind of expecting that yesterday. So let me put in day 31 and see where we're going to be at tomorrow. So the model predicts 7,163 tomorrow. So we'll see where that lands. It's about 2:00. So that data will come in around 5. But one other thing I wanted to share with you today was an image that was released yesterday in the Connecticut press conference. So here you see 4 different curves. Now, these are actually rate curves. So this is showing when the number of deaths is on the rise, and then we hit this apex, or in math, we would call it a maximum or a maxima. But this right here is Fairfield County. So they're predicting that Fairfield County is going to peak in terms of their rate of infected cases. Yeah, or daily hospitalization, sorry. They think they're going to hit their apex at around April 26th. So, 2 things to notice. They have New Haven County reaching their apex a little bit later and a little bit lower, which means the rate that they max out at will be less than Fairfield County. So, think about why that may be. Well, if you look on a map, Fairfield is the closest, then New Haven County, then Hartford County. So basically, this is showing that the virus spread throughout Connecticut up through the state. So social distancing took into effect around this time right here. So because we social distance and the virus spread later, then we're seeing an apex that's lower and later. So New Haven's going to experience theirs around May 10th, And then they're predicting that Hartford County will have their apex at May 24th. So that's some pretty sobering data, I think, because that's showing that Connecticut is going to have something like way farther into May than we had originally thought. And you can see around July 5th is when Connecticut will stop having cases. That's when they're predicting, I guess. Also, you notice eastern counties, because these are the ones that are really far away from New York. So not as many people came up into those areas. So that's a really low curve, but again, not peaking until May 24th. So this is a pretty, I don't know. This is a pretty wild chart because it shows me that this is going to be a little bit longer than we expect. So the good news is that they're showing less hospitalizations per county, so that is something to look up at. But I will post the link to where this chart is. It came from NBC Connecticut. They took it from the PowerPoint presentation of the governor from yesterday. So yeah, so not the greatest news today for Connecticut. The curve went up, and then we're getting some unfortunate predictions in terms of when the rates will apex. So I hope we get better news tomorrow. But in the meantime, I hope you have a great day, and thanks for watching. We reached episode 10. That's because people keep asking me to make them, so I'll keep making them if you keep watching them. All right. Have a great rest of your Tuesday.